multiplanar shoulder activities, also giving precision activities of the fingers, trying to target and improve the precision activities of the fingers. This is called as variables exerciser, which is available, which gives you all soft activities or the so-called soft coordinated activities can come up with this. Now this is one more thing. How much weight the patient is taking after femur fracture? My teacher told me 25% he has to take. My teacher told me 50% he has to take. Or when I was a patient, I took only this much. Now this is one more thing which is available, zero gravity, or also called as anti-gravity, which gives you complete no weight bearing positions on the lower limbs. You can increase the weight bearing on the lower limb as and when. It works basically on the NASA principle, where there is no weight on the lower limbs. You can use for any type of accident. You want an ankle sprain patient, you want to rehabilitate him, but today I want him a no weight bearing activity. Put him on this. He will do the activities, he will maintain the movements, but there will be no weight on the ankle. This is the advantage of this. So-called this helps in any surgeries, any injuries, spine problems, or lower limb fracture fixations, anything it can help. It will help in also improving the strength, it will help in conditioning. Now this is not only useful for patients, it can be useful for athletic trainings also. This is where just the information which I have written because of shortage of time, but can you please show the video? Patient enters into the cubicle, especially with this is an air chamber, which gives you a complete zero weight bearing below the waist. Zero gravity treadmill, which we call it. Depending on how much pressure you want, whether you want 50% of weight, whether you want 25% of weight bearing, you can set it and the patient does regular exercises. You want these patients to be used for training before going into sport, he has to do, but there should be no tiredness. Put him on this, they can do it very happily, and his whole energy will be used only for sports activity. This is very good for rehabilitation following lower limb fractures. It's a zero gravity or anti-gravity treadmill. Very good. Can the technology help us? Technology helps us. To be very frank, technology helps us. It all depends how we try to use it. It gives you good feedback. Patient will know every day what progress he is doing. Patient will know after every session. In fact, I have seen situations where patients come tell that, I think yesterday I did much better than today. What is wrong with me? Then I tell me what is wrong with you. Why you are not participating so actively like yesterday? He tells that over a period of 7 days I am not able to increase these parameters more. What is the problem? I am same, machine is same. What is the wrong? You have to tell me what is that. So this is what it gives you, quantitative feedback. It gives you progress. Patient, you can tell, okay, first day you came to me, what you have done. 10th day you came to me, what you have done. Basing on this, I think you may need next 10 more sessions to achieve your target. Complete progress you can see. You can improve this. Usually standardly what happens is that the therapist is trying to treat so many patients, 15 minutes, 20 minutes, half an hour, I am done. I have my next patient. But with these technologies, because they are machine aided, you can increase the time period if the patient wants, depending on where you want to be in the hospital. They are helpful as games. They will increase the motor ability capacities, more effortless also. There can be errorless. Patients can not do mistakes what they are doing because of the biofeedback. And else, the postural strain on the therapist is drastically reduced because of this. There are pros and cons, but with the help of this, you can always take the advantage of this. Traditionally, rehab was what I told. What I document is what rehab is. Till then. If I tell it is only 50 degrees subduction, it is 50 degrees. But now it is more accurate, it is more quantitative, it gives you more information. So technology is aiding in rehabilitation. What I mean by aiding in rehabilitation is nobody can replace a physiotherapist. But the value of physiotherapy and the services can be increased if you use the technology. The respect which you are going to get from your colleagues, from your interdisciplinary team, from your patients, from your patient relatives can increase because you have a documented evidence. Why does anybody tell that I am taking blood pressure medicines for last 1 month and whether the blood pressure is less or more? Because I am monitoring it, I am showing what is my blood pressure before taking medicines and after taking medicines. I don't know inside the body it really happened or not, I don't know, but the machine is showing. The machine shows and patient understands. This is technology and this is the future. Whether it is a well-developed country countries, developing countries or underdeveloped countries, a time will come where this is going to be part of all of our careers if we practice physiotherapy. So it's time for us to understand they are patient friendly, they are very good quality, more organized, everything, data collection becomes easy. Is that all what you have? Last week I met with one company. This company came across and told that I can tell when your patient is going to go in for an ankle sprain. I told what? Yes. They have come up with wearable sensors. Through the AI, it is attached to the mobile phone, and at the end of the day, it can give how much amount of ankle movements you have done, how much amount of strength is being used, how much amount of energy is spent, according to my body weight and BMI, what is my ability and whether I have crossed it or not. This is the next thing. This will become like how I carry my phone. This can become in the future that a sensor will be placed and a footballer or a sports person will just able to know that okay, today my quota is over, I have done this much, more than this I don't want to spend my energy. That is the role in prevention of overuse. So this is the future still coming, but it will come and help us all in the future. This is equilibrium software which is available. It can be just attached to the phone and it can tell all the parameters depending on what we want. So this is what technology is present. Technology will be future. The only problem is we, current practicing and future generation people, we should be ready to embrace it. If we don't accept it, we will be left behind. We have to embrace it and we have to create more opportunities for the patients. Plus, remember that technology therapy has to be combined with conventional therapy. Conventional therapy cannot be replaced. Conventional therapy cannot be replaced. Therapist cannot be replaced. So it's all what we try to understand. Documentation for us, people like us, we are working in the West, outside countries. Insurance is a big problem. Insurance comes and asks me, how do you say that my patient is progressed? How do I give you 10 more sessions of therapy? I don't have to say, the machine output will tell. So it's a quantity and quality assessment which is available. It will complement the conventional technology. Rehabilitation by using technology will only complement, it will never replace. Yes. Everybody tries to tell that, you are working in Dubai, so it is easy for you. You do understand that. There is cost which is involved. The people who are working, as I told you 10 years back, I did not know all this. But we have to have open hand, open mind to understand what the world is looking at. So that becomes a challenge. Because of this, in the international curriculums, now technology and AI has become a part of undergraduate curriculum. Undergraduate physiotherapy curriculum has one course called technology, AI and AI. It's not that we are not going to become mechanical engineers or AI engineers, but in which way we can try to use. It has to be accessible by the patients. Now what has happened is most of the companies which are trying to come across, because of the accessibility to many countries, they are coming up with projects where these machines can come into different countries. They will be placing in the hospitals. The patients will be trained on that so that accessibility, because they have to reach out now. Now they have started developing. Nobody to buy. Only few people to buy. So we have to look out for opportunities where we can tie up with these organizations, where they can support the students and also the patients. And of course, research is wide open. What it helps, how it helps, everything is quite possible. There's a very good potential of research activity which is possible in the technology for rehabilitation purpose coming in the future. There's some references for you. I'll take questions if anything is there. Thank you.
Thank you, sir. Your contribution to this research event has enriched our understanding and sparked meaningful discussion. We are grateful to your participation and willingness to share your knowledge with our community. Thank you again for your remarkable presentation and for being part of this event. We wish you continued success in your research endeavors. Thank you, sir.
on the field of physiotherapy. A discussion filled with curiosity, knowledge and enlightenment. I request the panel members to occupy the dais. I request the audience to welcome them with a huge round of applause. Dr. Madhavi, President of Andhra Pradesh Physiotherapy Association and Professor and Principal of College of Physiotherapy, SPIMS, Tirupati. Dr. Sendal Kumar, MPT, Ortho and PhD, the HOD of Physiotherapy Department in Wales University. Dr. Shahul, MPT, MBA, PhD in Physiotherapy and PhD in Business Administration, Associate Professor in Orthopedic Physiotherapy at University of Tabuk in Saudi Arabia. Dr. Prat Kumar, MPT in Cardiorespiratory and Intensive Care Unit, currently pursuing his PhD. And this session will be mentored by Speaker Dr. Paveen Kumar Kandakurti, the Dean of College of Health Science, Gulf Medical University, Ajman, UAE.
I request Dr. Hernan Labo on the stage, please. We are honored and privileged to announce that Savita College of Physiotherapy, associate with Stability Physio Care, represented by Dr. Kanavalakshmi ma'am, by signing Memorandum of Agreement. I request Dr. Pratap sir and Dr. Kanavalakshmi ma'am for signing the MOU. I request Dr. Kanavalakshmi ma'am to come on the stage, please. I request audience to give a huge round of applause. As we collaborate with Stability Physio Care, a memorandum of agreement has been signed between Dr. Pratap sir and Dr. Kanagalakshmi ma'am. On behalf of Savita College of Physiotherapy and Stability Physio Care, I request the audience to please maintain silence.
Thank you, sir, and thank you. We now
Thank you for all the expert panelists here. We would like to have a few discussions with your experience which is happening across and the main theme of the various innovations which are happening. I will take the lead to ask a few questions and later we will open it for the audience, mainly because students have the power for everything. You will have an opportunity to ask 2 or 3 questions of what you want. Of course, out of my experience, I would like to ask any of the panelists expertise that how do you feel is the present situation of the technology and the innovations which are happening and how helpful are they for you in the day-to-day practice? Any of the experts who would like to answer this will be helpful.
Hello. Good afternoon to everyone. So, thanks for the organizing team, the principal of Stride for creating such a platform for us to sit and analyze a topic which is the current trend. So it could be more beneficial for the student population as well. So with this, I would like to just commence my talk about what the moderator has just put on. So I would like to just go back when I did my undergraduation, post-graduation, and what is the scenario now and what is the need for the new innovations and technologies that is needed nowadays. When I did my undergraduation, there is no project. We didn't do any project, just we have academics, write the exams and get the results. So if there is no project, it means there is no research involvement in those times. So as the days goes on, in the upcoming years, when I did my PG, just we have started what is research is about. We don't have much idea about it. So at that time there is no ICT facility also. Just we went to a browsing center which was entirely different from what we have now. We put a floppy, take all the needed references, copy it, go to another center, take a printout. So this is what we have done previously. Now we can see drastic change. Even the BPT students is doing scientific research with the help of their supervisors. So they get immense knowledge from them and they are just exhibiting it. And also the PG students, they are excelling very well nowadays. As well, you know that PhD is booming a lot for the past 5 years, and hereafter it will be another remarkable in the research field, producing more research scholars and research guides. So now I feel the more innovations and technologies are being used now, and there is a need to carry out the research activities. Just the 2 speakers, what they have spoken in the first 2 presentations have given a clear idea about what are the technologies that are assisting the physiotherapy treatment nowadays. So just going back to that, we have to gain a more technical knowledge about it, gain a lot, we have to operate it, and we have to get successful, not only getting the knowledge from those devices, we have to implement it to the patients. So they have to be more comfortable. Even the patient ethics and values should be maintained. So they should enjoy the treatment. So it should get assisted. So even there is a controversy that physiotherapy actually we say it is a hands-on technique. So why we got to use the most technologies and techniques nowadays. But as Sir has concluded in the last presentation, the therapy should even know about what technologies are available now. We have to implement the same to the patient and get more advantages out of it. So this is my view on the need of new technologies.
Thank you, sir. Thank you. Passing on to the next question with the experts, I would like to ask one area which both the speakers did not touch on. Do you see any scope of tele-rehabilitation happening? And if it is happening, what is your take on that?
Thank you. Tele-rehabilitation, we see that we had 2019, 2021 COVID period, which has started, and the tele-rehabilitation started drastically in all the fields of medicine, and there was a lot of consultation going on. And then the physiotherapy part of it, when it had come for tele-rehabilitation, it was really a question mark and a challenge for all the physiotherapists. And even the patient, they were thinking how it can be done without the touch of physiotherapists. That was the question. Usually in India, not in advanced countries, in India, most of them expect only the physical touch and the physical presence of physiotherapists. And when we physiotherapists as an academician or an clinician, we have to prepare the videos for them and then give for the patients what are the things which they need to do in their house and have an interaction with them. So tele-rehabilitation is a one which is a really challenge, but I don't find much research which is going on with UG projects or PG projects, which is still, it was there during COVID period. After COVID, again it has come back with an offline physiotherapy, and they are not continuing this tele-rehabilitation which is required for physiotherapy. They can have a physical consultation on the first visit or second visit, and later they can continue this tele-rehabilitation, and it will be very useful, especially in the corporate cities like Chennai, Bangalore, Bombay, where the traveling becomes a very hectic both for patient as well as the therapist. There they can save the time, and many of the conditions can be done on tele-rehabilitation. Wherever it can be implemented, we can use the tele-rehabilitation. I think that is the thirst of challenge which has to be implemented practically in the physiotherapy field.
Thank you, ma'am. I think you have brought forward to one area of research which is very promising in the physiotherapy field to try and optimize the usage of tele-rehabilitation. Hopefully the generations will work on it. Moving on to this discussion, so I would like to ask the experts panel that if anybody is into the academics, how much of the academic curriculum changes are taking place to incorporate the innovations which are happening in the rehabilitation?
Good afternoon. I would like to express my thanks to Savita College for inviting me. So regarding an academic curriculum, from the government perspective, if I say, there is an inspection, there is an accreditation from government side, there are criteria. The first criterion in NAC, if we say, it's for the curriculum. We need to adjust our education system so that we can cope up with the current demand of technology with education, in healthcare, in education. What is the status of, if I say, especially for our physiotherapists, what if our students just learn the medical aspect and they completely ignore the technology behind that? If we discuss about the ultrasound, the basic machine, if we say therapeutic ultrasound, without the understanding of piezoelectric effect, that is a technology that has long gone research. Without the knowledge of that, a physiotherapist will not be able to understand what is the actual reason behind it of the treatment. If I say about the curriculum, we had upgraded from our university, if I say about, in our university, we had introduced three subjects, that is research and innovation at beginner level for undergraduates, in which the students will learn about the basic areas for the research. Not only that, what are the technological integrations we can go about, for which students are in, I would say there is an induction program we generally organize at our university about what are the, we generally start with what are the diagnostic criteria in which, what are the mechanically possible, that means manually a physiotherapist would do. What are the technological aspects, that means diagnosis by the machines can be done. What are the gaps? This is the thing that we facilitate a student into thinking, trying them that what can we do? Where are the gaps? How accurate are we? As you said in your presentation earlier, that human error will always be there. So this subject somewhere will help students into, understanding the mechanical aspect of the technology and help them into innovate something new or upgrade the current technology. Apart from that, the another subject which has been done in postgraduate program, which is an advanced level research, in which project is not a traditional dissertation which is like clinical trials or researches. We generally facilitate our students to do think on some innovations. What can we do about the current understanding of technology? What can you think? If they are really interested in that, out of 10 ideas, 1 or 2 potential ideas we get. And this has, since 5 and 6 years now, we are doing it. And now we can proudly say even our postgraduate students are thriving to, ask us about, what else can we do? And we are a physiotherapist, we are a movement doctors. So we are keen observers. We are not like the one of the best rehabilitation team member who can really observe a patient and the surrounding. With a much greater time we spend with the patients. So my students' personal experience, if I want to share, she has gone with her sister who was pregnant, and a gynecologist was doing sonography, and she has to constantly keep hands on the abdomen, leaving the shoulders abducted on air. And she was surprised, and she came back and told me that what can we do for this? She told the whole day that she will have to hold a probe and do the sonography all the day. She's having neck pain and she's having shoulder pain and all. What else can we do? I mean, what are the things? And I said that you tell us, what can we do? And she has then improvised a simple, if I say, curtains are there. So curtain channels are there. So she has developed a sling from those channels and did some pilot study on how it is well. I mean, because even the gynecologist will have to use probe. Along with that, they will have to apply gel, and again they'll have to use probe. So whether it is flexible enough, whether a shoulder movement has been given enough by that sling. So these are the great examples, I would say, that and subject involvement in course is helpful, putting it to that consideration.
I would like to answer to your point. This curriculum framation is very important, and transformation of curriculum is very important to meet the needs of the society. So the policy decision maker should have an awareness what is the needs of the society. So this transformation needs of the society, now we see the technology has been advancing, and integrated and interdisciplinary researchers are very important, and those things need to be incorporated in the syllabus, and that we are trying to do. And even accreditation boards has made a challenge to the policy decision makers to incorporate all these advances into the curriculum. So that has made
Yeah, I think one of the most important things that educators should be thinking about in terms of integrating technology into the practice of physiotherapy is first awareness. We need to be aware what is available. We need to be aware that technology doesn't have to be very, very expensive for us to integrate it with our own clinical practice. For example, there are certain mobile softwares that we can utilize for assessment, mobile softwares, for example, that we can utilize for X-ray gaming, that is available out there, and that we could utilize that for improving patient outcomes. Another thing that we have to consider is the acceptability of technology. There is what we call technology acceptability model that we have to consider as clinicians. And we have to cater, or we have to choose carefully the type of technology based on the patient in which we are going to use it. For example, an older woman may not be able to benefit from a robotic, technology-assisted rehabilitation. Because for her, that may not be that acceptable, right? But if we're going to use, for example, virtual reality, or for example, augmented reality, which is shown, for example, on a television set, for example, with some sensor on it, it may be more acceptable for an elderly woman to perform the exercise as compared to that of a robotic assisted therapy session. So it is imperative that in our curriculum, we need to teach our students to be aware about the availability of this technology, the availability of this equipment, the availability of technology-assisted rehabilitation. But more importantly, we need to teach them to carefully select which technology is best to use depending on the type of patient that we have. Another thing that we also have to consider is the learning curve. That is applicable not only to our patient, but to us as physiotherapists as well. We need to integrate technology into our armament of exercises, into our wide range of treatment options. And we have to do it in such a way that we also have to consider the learning curve of each individual physiotherapist and the learning curve by which this exercise will be accepted and will be understood by our patient. So all of these things, technology is there. Nothing can replace a good physiotherapist. That is for sure. But, just like what I have mentioned, AI and rehabilitation technology is very important. They cannot replace a physiotherapist. But a physiotherapist who does not use rehabilitation technology and artificial intelligence, physiotherapists who don't use rehabilitation-assisted technology will soon be replaced by one who does. So I guess that is the main takeaway from me.
Thank you so much. First of all, I would like to say my thanks to the organizing committee to give me the opportunity. Since we talk about the teaching and learning methods, especially the curriculum based, anyhow we are working outside of India, abroad, and we have different kinds of methods of teachings we are experiencing with the students. But when comparing to our country with our students, whether we are getting the same way of knowledge, and it's really, I'm not saying that it's a questionable, but we have to upgrade ourselves. We have to understand what is our curriculum, whether we are with that one, we are really updating this one. So according to our national accreditation, every 5 years you have to update your curriculum for your, and also your teaching strategies and your learning methods. So these will help the students to improve. As doctor said, it's not only for the students, it's to be as a teacher, as a faculty, we have to upgrade us. So this is the way we are talking about innovative. What is innovative? Innovative is nothing but, as Madam mentioned, it's a kind of integration. Integration is the word. We are still belonging to in our profession for all the time. We just think about physical therapy and the exercise and the equipments and how we are interconnecting with the other facilities, like with the other departments. Are we collaborating? This is what we are expecting. Now the whole world is looking for how you are integrating with other professions. Like for example, we are ongoing genetical research we are doing. So just simply sitting in your lab and think about the genetic, what you will understand about this. You have to explore and you have to go and talk to the other healthcare professional to share your views. Especially even in we are conducting our symposium or conference, we have to be openly, deliberately to call the other professionals to come and share their experience with us. So we have to work together. For example, we talk about genetic, for example. How many students understand about what is genetic, what's going on in the physical therapy practice? So for example, we take an intervertebral disc degeneration disease. You know that. What is a genetic based? It is a type of collagen that you should understand. What are the type of collagens inside our body? So these are all the type of innovatives we have to introduce in our curriculum, and we have to expose ourselves to the other faculties and other members to make them an open platform to discuss with them. It's just an example. I'm talking about the genes, because the future trends, the future thing is going something not only which is not limited to AI and other robotics, it's going beyond the limit of the level. We are talking about the cells, we are talking about the genes, and we are talking about different things in the body parts. Whether are we aware that we are doing research in this basis, there are lots of innovations. It's present in our human body itself. So you have to think about it and you have to explore your knowledge. So these are all the way we are integrating the curriculum and everything to make you to be more understanding. And as a student, you have to explore. You have to not just to stick with the slides or with some kind of limited materials. You have to go and explore your research. You have to know what is evidence-based, what is clinical practice guidelines. So there are many things you have to explore, and not to give any information to the community or the people just like what you understand. You have to go with the basic evidence-based practice. That's what our keynote speakers, they focus more on the recent technologies, how you have to be with that, and you have to update your knowledge. This is purely based only on the research, not just like only the learning experience or just to read the textbook, which is not sufficient for our students. So please keep it in mind, and you have to think a little more out of the thinking of the box, to think about your profession, how this is your responsibility as each professionals. You have to think over it and you have to show the innovation in your field, and you have to explore more, and at long it should. What is the purpose of reading these things? You have to serve to your community people. Today we are seeing there are lag in the clinical practice, as Dr. just before mentioned. We are focusing only in the theoretical part. When we come to the practical, we just go stand and come back. We don't know what is assessment, when we have to take the assessment, what is the period, what is the timeline, what is the exercises. Even our keynote speaker, we talk about the exercises, whether we are really doing the real sessions with the patient. Every time we are just looking care of our blocks to when I have to complete my treatment, when the next patient I have to attend. This is not our agenda. Even if you see 2 patients, 3 patients per day, at the end of the day you should be satisfied yourself what I did it for my patient. Whether really it is improved, not just like that to tell, to yesterday they came, today he improved. This is not we are looking for in the International Physical Therapy Forum. We just want to evidence-based, how many sessions you treated. So as you are a therapist, if you involve based on these type of treatment methods, you can create innovative. You can come up with your own guidelines. You can come up with your own knowledge. So it will help for you, for the community, and overall you will have a healthy lifestyle during your period.
Thank you.
I'll just add very quickly. I totally agree with Dr. Sir. I think need to remember that although rehabilitation is there, adjunct therapies are there, innovations are there, we cannot draw away from the basic principles of exercise therapy. Like for example, we need to observe and take into consideration motor control, motor learning principles. No matter how good you are in robotic technology, if you don't know transference, if you don't know repetition, the importance of motor learning, if we don't understand the motor concepts and the motor theories, then all of these things wouldn't be, beneficial for our patient because we cannot translate it into something that would be practical and something that will target what we really wanted to develop among our patients. So we cannot draw away from the basics of exercise therapy. We cannot draw away from the basics of rehabilitation. These are adjunct therapies, and as such, we can add them to what we are currently doing to better produce patient outcomes. Alright, but we cannot draw away from the basic tenets of rehabilitation, and that is one thing that is for sure. So I think we have to make that clear that we have to consider ourselves, we have to consider them as an adjunct to our usual treatment, but it is still very important that we know the basics. You cannot proceed to advanced technology if you are not yet aware about the basics of rehabilitation sciences. Thank you.
Yes, madam.
What I feel is, now I see a lot of colleges, conferences and in South India and North India. In physiotherapy field, the clinician is separated, academician is separated and research. That is not the right way. See, if a teacher is teaching a student and having a case discussion, he has to discuss, guide the student how to interact with the case with a neurologist or with a biomedical engineer or with whatever the technical aspect of it. If a teacher can incorporate that method of interactive session, then only the student will be able to learn the things. And the other thing is, whenever you are doing this, the clinician thinks, clinical therapist thinks that it is only treating the patient. Academician thinks that it is only teaching the theory and practical class. That is not right. And many of the teachers also fight with me that we are the academic people, we want to concentrate only on the academic. No. Only when you are a best clinician, you become a best academician. And both clinician and academician only can become a researcher. So the teacher has to upgrade themselves within a knowledge how to guide the student have an interactive session. That is more important.
Thank you, all respected.
So to inculcate the technical ideas in the minds of the young and budding students and therapists, I urge the educational institutions to offer more interdisciplinary courses and value-added courses where the physiotherapists can learn more technological and technical concepts which will be helpful for them to handle the equipments which is being one of the challenges for them. So while we should not treat just like a core subject on physiotherapy and electives, we have to learn more concept that was out of the box so that the students can manage the technical issues and the technologies available in the field of physiotherapy.
One thing I would like to add in this sentence, either it is technology or the magical hands of physiotherapists. It is the passion of an individual makes the magic of the treatment or the prognosis. Unless he has an interest to identify what is the problem, what exact treatment is required, either it is conventional or advanced therapy, only then he will have an interest to learn and do the things. So it is the physiotherapy, any healthcare professional should have an interest how to make an improvement in a patient. Either it may be conventional or an advanced technique.
Thank you all respected panel members. As we started We would like to give opportunity for any 2 questions from students. If you want to ask anything, please come forward, because you are the future generation. What we talk, we already know what we are talking. Any student wants to ask any question, please take the opportunity. Please come forward. Usually it does not happen in panel discussions, but I am always passionate that students should be the voice. Whatever we are doing is only for you people.
Greetings, I'm Jeevarathina. My question is how to standardize here, develop the research product. For example, think a watch we develop, how to standardize that for a clinical trial.
Yeah, see, now what you have to try and do is that what you have mentioned is a thought which you have, is an idea which you have in you. If this idea has to be justified, what we call it as whether it is an ideal research question or not. To become a good research question, first you should have a thorough background for that. What I think every time is not only what I think. There might be 1,000 minds in the world who already thought about that particular point and have established. So this is what which we call it as a detailed review of literature, which you have to try and understand what I am thinking, am I correct or not? Has anybody else thought about it? Up to what extent have they gone? Basing on that, you either modify what you are thinking or you try to change the direction. This is the whole process of what we call it as review of literature. Plus, once you confirm that your thought process is correct, you need to take support of supervisors or your faculty. If it is a new novel idea, in the current world where everything is competitive, you need to have a patent registration. If you don't want your idea to be stolen by somebody, the Indian government is very open. I see on social media hundreds of physiotherapy students and faculty patenting their ideas. If you patent your idea, then that is your property and you will have to start working on it like a business project if you want to do it.
Sir, how to evaluate the safety for a clinical trial?
Yeah, evaluation of clinical trials or safety of clinical trials, there are certain protocols which are the clinical trial evaluation protocols. There are certain scales which are available. You have to adopt which type of scale you will see, and basing on the measurements which is available, which score you fall, then you will try to understand at what safety level you are going into that.
It is available for electronic device.
Electronic devices, we will have to get in continuation with mechanical engineering background. That is what Madam told, is an interdisciplinary. Sometimes we will be stuck with what I want to do, but I don't know how to do. Like what you asked me, I am into the field from 25 years. Madam will be more senior. At this point, she will try to understand that this is my idea, but I need a confirmation from a mechanical engineer background. And this is the place where we call it as interdisciplinary. It does not mean that we have to only contact a internal medicine person or an orthopedic person because we are health professions. I hope I answered.
Yes, thank you.
Actually, I don't understand your question, to tell you honestly. But you were asking about research questions a while ago, right? Yeah. So, actually, research questions, there would be basic elements of a good, an accurately formulated research question. But you're not able to formulate a research question unless otherwise you have performed an intensive literature review. Because that is only when the correct research question can emerge from. How would you be able to come up with a question when you don't know anything about the topic, right? So for you to be able to come up with an intelligent research question, you need to have an intensive literature review about a particular topic. Although it is not much related with what we talked about a while ago. But since I am teaching research previously, it actually takes me back when I was teaching my students on how to formulate a research question. Because remember that formulating a research question is one of the most important tasks when you're conducting your research. Just like what they mentioned, it is not actually the question, but it is the question that you ask, which will make or break your research proposal or your research topic. Now, there is no standard way of putting a good research question, but there are basic elements that you should be considering when formulating your research question based on the Center for Evidence-Based Medicine. So I believe that you have to start from there. And more importantly, you need to build on good knowledge about the topic by doing an extensive literature review, and only then will you be able to come up with a research question that you would like to answer with your research paper. Thank you.
Thank you. I think one more person is waiting. He wants to ask a question.
Hello. First things first, thank you for giving this opportunity. I'm Sundar from first year PG. Each and every year, a lot of physiotherapists are graduated from the colleges. Okay. One technology can reduce 20 physiotherapists' duty, right? So, is this a growth or inflation? How the future will going to be? Is this good, or we can able to manage this? This is my doubt.
You need to, sorry, any other member? Yeah, you need to try and understand that at any point of time, the situation is not going to come that there will be more number of physiotherapists possible. When it will come, where the number of people who are getting injured or diseased are becoming less. Now, even if you try to understand also, even in a country like India or a wide world country, what every time happens is that physiotherapy population or the professionals want to stick around. I want to practice only in Chennai. I want to practice only in Bangalore. When you start realizing in your career that this particular place is infiltrated, there is no possibility for me, you start looking out for opportunities, number one. Number two, as I rightly mentioned and as my colleague also mentioned, technology will do the work, but who is feeding the technology is important. A patient will not be able to completely buy a robot by himself and tell that I will use for myself and I will rehabilitate myself. He will need a physiotherapist. Yes, irrespective of how many number of physiotherapists will come out, irrespective of how many number of technologies will come out, the machine and human interaction is the only one to have an efficient output of this machine. That is why in my last slide which I told you, in the world now there are many companies which are producing the robots. It has become a competition for them. But what has happened, it is not reaching everywhere. It is only reaching the places where there is money. And that is why I told you that there are companies which are coming out and trying to tell that you can have join hands with them as research collaborators, where they will give you the machines, they will put the machines in your setup, and you will do the work and give the data to them. So this point, if you keep telling that okay, one machine will do 20 people's job, can never happen. When it can done, when these 20 people don't know what to do, I have graduated, but I only know how to give an ultrasound. If I am 20 of them, then I should not try to bother that why I am not succeeding. So if at a student level, everybody is trying to tell this. Of course, when you are a student and when I was a student also, it is very easy for us to understand, yeah, you people are all graduated, you will tell so many things, but it is not practical. But believe me, all of us who are sitting here have come from that side to this side. It is not that we just born like this. Experience counts, interest counts, passion. It will take, nobody is going to come and tell that as soon as I graduate, okay my friend, you have graduated from some aims, so I'll give you a job, please welcome. No. Even people who graduated from the best colleges, best universities also will struggle for jobs. Why? Because might be they are not competent enough. If I am competent, if I am 100% sure of what I have learned, work will come for me. This you have to learn.
I guess it's very important that we have to, again, just to bump on with, or to piggyback with what they have mentioned a while ago. Technology cannot replace physiotherapists. So you don't have to be afraid that technology will take over our role. Because there are certain things that technology cannot replace: human interaction, the emotional cues and psychological cues that only us can interpret from our patient. And those are some of the very subtle things that we do, subtle roles that we perform, that cannot be replaced by a machine, that cannot be replaced by AI, that cannot be replaced by technology. So we don't have to be afraid of technology. It's just that we need to we know before when I was studying for my bachelor's degree may no longer be applicable to what is currently happening in our practice. So what is the bottom line? Every one of us, students, faculty, policymakers, should recognize the importance of lifelong learning. Because if we develop that sense among ourselves, we'll be able to incorporate whatever comes, whatever the innovations come, whatever technological advancement will come, we'll be able to integrate it with our own practice, and we'll be able to make use of it at our own advantage. The good thing about physiotherapy is that, number one, it is AI-proof. Healthcare is one of the few sectors, few professions that is least affected by it may be affected in some sense, but it is less affected compared with other professions. Because other professions may be replaced by machines, particularly those professions that require repetitive tasks, repetitive activities. But physiotherapy cannot be replaced by machine and technology. Human interaction, empathy, optimism that we incorporate with our daily treatment and interaction with the patient cannot be replaced by machine. And those are the important elements of physiotherapy or rehabilitation that only physiotherapists will be able to do. Thank you.
Thank you all respected delegates for this interactive session, and special congratulations to the two students who came up to discuss. That is what everybody needs. Thank you.
Thanks to all the dignitaries on the dais, all Tawas and physiotherapy. Thank you once again on behalf of Center of Physiotherapy. I take this opportunity to thank Praveen sir, Memorandum, and Mahatman sir, Nandal sir, Shao sir, and Vivek sir. All kind acknowledgements from our Center of Physiotherapy. Thanks for sharing valuable information on the technological trends in physiotherapy. Thank you once again. We'll take a quick picture. Thank you.
I would like to extend my heartfelt gratitude to each and every one of you making this research event resounding success. Your presence has enriched our gathering and your contribution has elevated our discussion. To our keynote speakers and presenters, thank you for sharing your experts and insights with us. Your passion for research is truly inspiring, and we appreciate the time you took to prepare and deliver your remarkable talks. And our participants, your engagement and enthusiasm had made this event truly memorable. We hope you have formed a meaningful connection and gained valuable knowledge to advance your research pursuit.